Greetings, iPrevent followers! August is National Eye Exam Month, so today we will explore the complexity of eyes and the importance of getting an eye exam. Let's get into it. Our eyes are incredible organs. In fact, eyes are the second most complex organ, trailing closely behind the brain. Did you know? Your eyes allow you to see 10 million different colors, and some people even have supervision, allowing them to see 100 million different shades. Or, did you know that the shark cornea is nearly identical to the human cornea and has even been used in human eye surgery? There are so many more cool things about the eyes, but it's time we get back to the basics. What is an eye? What is vision? Our eyes are made of over 2 million working parts and 107 million cells. These parts and cells come together to form 14 different components of the eye that allow us to see or give us vision. The parts of the eye that are visible to us include the pupil, iris, and sclera. The eyelid serves as a protective barrier for the eye. Many people think that the pupil is the colored part of an eye, but actually, it's the black center of your eye that allows light to reach the retina, which we will get to. Rather, the iris is what gives the eye its color. The amount of melanin in the eyes determines color, and melanin is then determined by genetics. The sclera is the white part of the eye that functions as a support wall. These exterior parts are where the process of sight begins. Every part of the eye we've discussed and will discuss can be injured or malfunction. This is why it's important to get an eye exam. Most of these issues can only be caught and properly treated by an eye doctor. If the problems are caught too late, there can be permanent damage to your vision. Common problems related to the exterior part of the eye include scleritis, iritis, and conjunctivitis. Conjunctivitis, or pink eye, can occur from infection or inflammation of the very thin tissue that lines the outside of the eye on top of the exterior parts and lines the eyelid. A doctor may prescribe antimicrobials, eye drops, antivirals, or other treatment depending on what is causing the inflammation, for example, allergies or a virus. Usually mild, conjunctivitis can be cured relatively easily, though, if it goes untreated, the cornea may become scarred, affecting your vision. Next is scleritis, or inflammation of the sclera. Often caused by autoimmune disorders, injury, and infection, scleritis is a condition where the white of the eye becomes painful and inflamed. If left untreated, scleritis can cause vision loss. Similarly, iritis, or inflammation of the iris, is often caused by autoimmune disorders, injury, and infection. Symptoms include eye pain, light sensitivity, headache, and decreased vision. This can be treated with prescription meds, though if left untreated, severe and permanent vision loss may occur. Once again, the only way to find out if you have these conditions and get treated for them is to get an eye exam. There are a few other parts that you can't see, but are very important. When you go to the eye doctor, they will be examining these invisible layers of your eye. First is the cornea. On the front surface of the eye is a see-through, circle-shaped cornea that rests on top of the pupil and iris. Picture the cornea as a clear window that focuses light into the eye. From here, light penetrates the lens of the eye so that the light focuses onto the retina. Several eye issues that most people experience are due to the irritation or injury of the cornea. For example, the cornea is responsible for itchy eyes during allergy season, as well as the sensation of dry eye. Contact lenses can cause a corneal infection called keratitis. These infections can be treated with eye drops or pills. However, if left untreated, laser treatment or cornea transplant may be necessary. Astigmatism is also a common condition. It arises when the cornea has a different shape than normal. Symptoms include headaches, eye strain, and blurry vision. Though, treatment options are abundant, and your eye doctor can help decide what the best treatment plan is for you. Once again, the only way to find out if you have these conditions and get treated for them is to get an eye exam. Next is the lens. The lens of the eye is a transparent structure that's suspended immediately behind the iris and works to focus the light entering through the pupil on the retina. Cataracts are the main issue here. This condition causes the lens to be cloudy, distorting the light that is trying to reach the retina. This condition is most common in people around the age of 80. The treatment is a simple and safe cataract surgery. The retina is a soft layer of tissue that lines the back of your eyeballs. The retina is composed of millions of light receptors called rods and cones. Each eye has about 120 million rods and are responsible for allowing us to see in dim light and darkness. It detects shades of gray, though cannot detect color. In comparison, each eye only has about 6 million cones, but they are responsible for allowing us to see those 10 to 100 million different shades of color. Problems with the retina include the experience of nearsightedness and farsightedness, or myopia and hyperopia. Nearsighted people can only see objects close to them clearly, and farsighted people can only see objects far away from them clearly. Nearsightedness is caused by a light focusing in front of the retina rather than directly on it. In other words, the eye is abnormally longer and the light can't reach the retina. Farsightedness is the opposite. The light focuses behind the retina due to the eye being shorter than normal. Treatment includes prescription eyeglasses and contacts. This can only be diagnosed by an eye exam and treated by an eye doctor. Another common human experience is the presence of floaters in our vision. If you see floating spots that aren't there, well, you know what I mean. The retina is responsible for this. If the floaters become severe and disruptive, surgery and laser treatment may help. None of these parts would matter, however, if it weren't for the optic nerve. The optic nerve carries signals from the retina to the brain, which interprets them as the images we can see. Even if our cornea and retina are seeing just fine, when the optic nerve is damaged, the brain malfunctions and stops sending the visual images back into the eye. Those with diabetes, muscular sclerosis, and autoimmune disorders are most at risk for optic nerve damage and diseases such as glaucoma and optic neuritis. These conditions can only be diagnosed by an eye exam, and if left untreated, some conditions may cause vision loss in one or both eyes. If all of these eye problems didn't convince you that an eye exam might be important, here are some benefits of eye exams. First, eye exams detect other health problems too. During a comprehensive eye exam, your eye doctor uses the health of your retina's blood vessels to predict the health of blood vessels throughout your entire body. For example, the visual condition of the blood vessels can display signs of diseases such as diabetes and hypertension. Second, it can save your child's vision. More children are becoming nearsighted each year, which is an issue because nearsightedness will continue to progress and cause vision problems throughout the lifetime. This creates a high risk of sight-threatening eye conditions later in life. Not to mention, 80% of all learning is through the visual system, and decreased vision can significantly affect educational success, athletic ability, and even social interaction. Third, good vision increases safety. Poor vision can have far-reaching side effects such as depression and increased number of car accidents. Most importantly, though, bad vision can lead to falling, which is the leading cause of death for people over the age of 65. Now, many of you may be thinking that your eyesight is just fine if you pass the eye test at your yearly medical checkups or at the DMV, for example. However, these are what we call eye screenings, and eye screenings are different from eye exams. Exams are performed by doctors. You may see an optometrist. They diagnose and treat eye conditions. Or you would see an ophthalmologist if you have an eye disease or need optic surgery. Now for the hard part. Unfortunately, eye care is not covered by most insurances. That means that an eye appointment might be somewhat costly. However, there are options. Large retailers that offer eye care and eyewear often do so at a much lower price than a private office. Walmart, Costco, and Sam's Club have eye care clinics staffed by qualified optometrists. Second, try getting an eye exam at a nearby hospital, optometry school, or medical school. Training institutes like these usually offer discounted or free vision care. Community healthcare clinics are also a good option if you are uninsured. Some clinics may provide sliding scale services where the charge for services changes based on your ability to pay. Though Odyssey House does not offer vision services, there are several clinics in the city that do. For example, DePaul Community Health Center Vision Center, located on South Carrollton, offers primary and pediatric eye care, discounted eyeglasses, in-house optical lab services, contact lenses, and screening for vision problems. It is also on the bus route, making it easily accessible using public transportation. Another is St. Thomas Community Health Clinic, located on St. Bernard Street, not far from the iPrevent headquarters in Mid-City. Doctor or not, here are some things you can do to protect your eyes. First, know your family's eye history. It's important to know if anyone has been diagnosed with an eye disease or condition, since some are hereditary. 2. Eat right to protect your sight. In particular, eat plenty of dark leafy greens, such as spinach, kale, or collard greens, and fish that is high in omega-3 fatty acids, such as salmon, albacore, tuna, trout, and halibut. Third, wear protective eyewear when playing sports or doing activities around the home, such as painting, yard work, and home repairs. And lastly, quit smoking or never start. Before I let you go, don't forget, iPrevent is here for you. If you need free condoms, lube, HIV, hepatitis C testing, naloxone training, or sterile syringes, just call us at 504-418-4955 or DM us on social media at iPrevent_OHL. That's it for now, iPrevent followers. Thanks for tuning in, and remember to like, follow, and subscribe for more iPrevent content.